Welcome to today's lecture on magnetic resonance angiography, MRA. In this comprehensive session, we will explore the principles, imaging techniques, and various applications of MRA in clinical practice. We will also discuss the use of contrast agents, the comparison between MRA and CTA, and safety considerations involved in MRA procedures. MRA employs magnets and radiofrequency pulses to capture detailed images of blood vessels without invasive procedures. By aligning protons in the body with a magnetic field and emitting signals during resonance, MRA produces high-resolution angiographic evaluations. It builds upon the principles of MRI. Contrast agents play a crucial role in enhancing the diagnostic capabilities of MRA. Gadolinium-based contrast agents, GBCAs, are most commonly used in MRA procedures. These agents have paramagnetic properties, which alter the magnetic signal intensity and provide better visualization of the vessels. GBCAs are administered intravenously and selectively accumulate in the blood vessels, increasing the contrast between blood and surrounding tissues. The utilization of contrast agents improves vessel delineation and aids in the detection of vascular abnormalities such as stenosis, aneurysms, and vascular malformations. With its ability to provide detailed information about blood flow velocity, directionality, and quantification, phase contrast MRA is a valuable technique for assessing conditions like intracranial hemorrhage, arteriovenous malformations, and vascular shunts. Its reliance on the phase shift of the magnetic signal from flowing blood allows for accurate imaging. MRA and computed tomography angiography, CTA, are both used for non-invasive vascular imaging. While CTA involves the use of X-rays and iodinated contrast agents, MRA employs magnetic fields and gadolinium-based contrast agents. Both techniques offer valuable diagnostic information, but their choice depends on factors such as patient age, renal function, and specific clinical indications. MRA is preferred in patients with renal impairment or contraindications to iodinated contrast, whereas CTA is advantageous in cases where high spatial resolution and rapid imaging are required. MRA allows for the evaluation of specific vascular territories, enabling the identification of potential areas of stenosis, aneurysms, or occlusions. By acquiring detailed images of the intracranial vasculature, including the anterior, middle, and posterior cerebral arteries, clinicians can assess blood supply to different regions of the brain. Moreover, MRA provides valuable insights into the vascular territories of other organs, such as the kidneys, liver, and peripheral arteries. These assessments are essential in diagnosing conditions like renal artery stenosis, hepatocellular carcinoma, and peripheral arterial disease. MRA plays a crucial role in the evaluation of intracranial aneurysms. It allows for the accurate depiction of the aneurysmal sac, its size, morphology, and associated parent vessels. Additionally, MRA aids in assessing the risk of rupture by analyzing flow dynamics and identifying any intraluminal thrombi. By utilizing MRA, clinicians can determine the optimal treatment approach, be it surgical clipping or endovascular coiling. MRA follow-up examinations are also valuable in monitoring the post-treatment results and detecting any potential recurrence of aneurysms. MRA is highly sensitive in identifying arterial stenosis, particularly in patients with cerebrovascular diseases and atherosclerosis. By visualizing vessel morphology and assessing the degree of luminal narrowing, MRA helps guide appropriate therapeutic interventions. With techniques like time-resolved MRA and three-dimensional acquisitions, MRA provides accurate measurements of stenosis severity and the potential impact on blood flow. This information guides treatment decisions, including medication management, revascularization procedures, and risk stratification. Congenital vascular anomalies encompass a wide range of conditions, including arteriovenous malformations, AVMs, venous malformations, and vascular tumors. MRA serves as a valuable tool in both diagnosis and preoperative planning. Through detailed imaging, MRA helps delineate abnormal vessels, their feeding arteries, draining veins, and the presence of arteriovenous shunting. Precise characterization of these anomalies is essential for the selection of appropriate treatment modalities such as embolization, surgical resection, or radiosurgery. In cases of intracranial hemorrhage, MRA plays a vital role in identifying underlying vascular malformations. The technique aids in detecting arteriovenous fistulas, cavernous malformations, dural arteriovenous fistulas, and aneurysms, which may be causative factors leading to hemorrhage. Accurate identification and localization of these lesions through MRA enable clinicians to plan appropriate interventions, including surgical resection, embolization, or radiosurgery. Additionally, MRA follow-ups provide valuable information on treatment response and potential recurrence. Perfusion imaging using MRA provides valuable insights into tissue perfusion and physiological parameters like blood flow, volume, and mean transit time. It aids in the evaluation of ischemic stroke, brain tumor grading, and assessing the response to therapy. Using advanced MRA techniques such as dynamic susceptibility contrast, DSC, or arterial spin labeling, ASL, clinicians can obtain perfusion maps, allowing for the identification of ischemic areas and assessment of treatment efficacy. MRA is an essential tool in the evaluation of peripheral artery disease, PAD. It enables the visualization of stenosis, occlusions, and collateral vessels in both the upper and lower extremities. MRA provides critical information for surgical and endovascular planning. By assessing the disease extent, vessel patency, and collateral circulation, MRA aids in determining the feasibility of revascularization procedures and guides therapy selection. Serial MRA examinations in follow-up also facilitate monitoring disease progression and treatment response. While MRA is generally considered safe, there are specific considerations to ensure patient well-being and avoid potential risks. Gadolinium-based contrast agents used in MRA have a rare association with nephrogenic systemic fibrosis in patients with severe renal dysfunction. Additionally, precautions should be taken in patients with implanted devices like cardiac pacemakers, cochlear implants, or metal fragments, as these may interfere with the magnetic fields in the MR environment. Detailed screening and strict adherence to safety protocols are necessary to minimize any potential hazards. Magnetic resonance angiography, MRA, offers detailed, non-invasive imaging of the vascular system. It accurately evaluates various conditions, like aneurysms and peripheral artery disease. Comparing MRA to CTA showcases their unique benefits, while prioritizing patient safety. MRA's versatile applications aid clinical decision-making and enhance patient treatment.